Hello and welcome. And today I'm really pleased to be joined by Sarah. That's Dr. Sarah Swan, who's a consultant clinical psychologist who has worked in the NHS for around 25 years, accumulating and being head of psychology for a large London borough. In fact, Sarah, you don't mention which one.
So it's Croydon.
And now you work in independent or private practice.
I do.
You're particularly interested in trauma and substance use. So welcome, Sarah.
Thank you very much. Thank you for having me.
So today we're going to talk about Sarah's book, which is, and I always do this, and half the time it never bloody works. I don't, does that work?
There we go.
Coping,
Yeah.
Coping with Breast Cancer, which is part of a series. In fact, it's a series that Sarah's just explained to me that she came up with a conceptual idea of people that she knows who've, well, actually, Sarah, explain it. You're better explaining it than me waffling on.
So all the books are written by clinical psychologists who have gone through particular sort of life challenges, health challenges, and so they're sharing their own experience as well as their skills and knowledge of as clinical psychologists to be able to provide practical coping strategies for other people going through similar experiences.
Right. So the one that we're going to talk about today is obviously your own journey, your own personal journey, coping with breast cancer. And one of the methods that you use is something called ACT, which is, and I have it written down, acceptance and commitment therapy, which you use, which I think is to great effect because having read, having gone through your book, what I really felt was that I was you, the layperson, going through this journey. And at the same time, you were also talking to me as my own personal psychologist, explaining how to accept what was going on and how to move on. And I just found it was a very personal experience because you were talking very much as a lay person, which I think is quite interesting because lots of times clinical people just talk about very much in the third person, they're very removed. And when you're going through something that is deeply affecting your life, which is new to you, it's very frightening. And I just felt you were there holding my hand, saying, actually, it's going to be okay. It isn't going to be a bed of roses. It's going to be tricky. It's going to be hard. But just I don't know how to explain it. I felt like I had to relax into it
Mm-hmm.
and accept what was happening, but know there was another step on. You were going to take me on to the next step. So yeah, I thought it was a really, I don't want to say enjoy, I always say enjoyable reads, and I think, oh no, how can something like this be an enjoyable read? But do you understand what I'm trying to say?
I do, and I'm really pleased to hear you say some of those things because I think there's some ideas in there that were really important to me in writing the book and in developing the series that, as clinical psychologists, along with a lot of other health professionals, in our training, we've really taught not to share about our personal experiences. Of course, when
Mm,
we're in the room with someone, we need to be really careful to make sure it's about them and not about us. But I think there's something, really valuable that we've got to share in terms of our own experiences and in demonstrating that we're humans and
mm,
we go through our own struggles. And even with all these years of training and experience in how to support others with emotional difficulties, I still found this an incredibly painful and difficult journey.
mm,
And I think that's something that the acceptance and commitment therapy approach is really good at as well. It's really non-pathologizing it. It's not about saying you're wrong or broken to be feeling certain ways. It really emphasizes that actually life is difficult and that we
mm,
all go through our own challenges and that difficult thoughts and painful emotions are a part of life. They are inevitable. And actually, kind of popular culture these days sort of stresses that we need to think positively and kind of be happy. And actually this approach kind of debunks that myth and says actually life's pretty tough.
mm,
And if we can try and accept our emotional experiences and connect with them and open up to them, rather than just trying to, think positively and feel guilty perhaps because we're not feeling happy, then actually that can free us up. That can free those emotions up to be able to move more easily. And so actually it can be a much better way of managing difficult thoughts and feelings.
So do you want to just, I mean, I know you've given a real brief sort of summary. Do you want
Mm.
to, if we just talk about what ACT is, because it it is all the way through your book. So your book is broken into chapters of, from the original diagnosis all the way through to the end when we look at your body image and the future for you.
Mm.
And ACT is, you've put it all the way through the book as very practical things of exercises of
Mhm.
what to do. So should we just talk about ACT first, and then we'll talk
Mm.
about your journey and how you then applied it?
Yeah, absolutely. So I like to think about three cornerstones really for ACT. One is connecting with the present moment. That so often our minds are caught up in thinking about the past or worrying about the future. We're thinking about I don't know, something we said yesterday and whether that upsets someone, or in relation to the cancer, why didn't I go to the doctor sooner when I noticed that thing happening, and that can take us down a whole rabbit hole of negative thoughts and feelings and leave us in a really kind of distressed place. Equally, going ahead to the future, thinking about what does this mean? Am I going to survive this? Will I live to see my children grow up? Again, that's going to take us into a really painful, dark place potentially. And it's not to say that we shouldn't have those thoughts, because they are absolutely normal and to be expected. But it's about how much we engage in those thoughts. And when things are difficult, getting present can be really helpful. Just connecting with how I'm feeling right here, right now, what's going on in my environment, just grounding with the present moment, because usually the present moment right here, right now is tolerable. But it's these worries about the past or the concerns about the future that can feel really intolerable. So mindfulness is a thing in popular culture these days. So that's one of the ways that we might help people to kind of get present. The second stage is about opening up to our experiences, our emotional experiences. So as I say, we can often get caught up in trying to get rid of, I don't like this feeling. I want to get rid of it. I want to push it away. I want to sweep it under the carpet. I want to distract myself. But actually, if we're always doing that, it becomes a bit like a jack in a box where we're just holding the lid down. And then sometimes this stuff will burst out when we least want it or least expect it. Or we just find ourselves constantly in a struggle with it, kind of like a tug of war. And so by opening up to it, choosing when we do that, allowing space for these emotions, it can help us to let go of that struggle, let go of that fight. And people often worry that it will become overwhelming, but usually it becomes kind of more tolerable. We learn that actually we can sit with this stuff.
And it's quite often it's not always as bad as you. If you're not
Absolutely.
facing it, your imagination runs away with it, and it's sort of
Yeah.
sitting there, isn't it?
Yeah, absolutely. And it might bubble over into other areas. You might be sitting with a lot of anxiety, but maybe that bubbles over into anger with your partner, or frustration with your kids or something. So yeah, by actually allowing time to connect with it, can be helpful for you and then for others around you too.
And also, I think quite often when you first see a problem, because if you look at it as a problem or an issue, you think, oh my God, there's no answer, there's no solution. although I know what we're talking about, there isn't necessarily a solution.
Mm.
But the more you got it and you play with it, and I assume that's what you mean by able to give yourself room, the more you see it and start looking at it from different angles, you're becoming more to an acceptance, an understanding of what it looks like and feels.
Yeah, and that's a really good point, that our brains have got very good at problem solving. You know, we've survived as a species because of our ability to problem solve. The problem, though, is our brain tends to do that too much.
Mm.
And so we're constantly in this problem solving mode. And sometimes just sitting and connecting with how you're feeling, noticing, you know, how is this emotion showing up in my body right now? You know, breathing into that area can help us to get out of this cognitive problem solving and into the feeling.
Mm.
And you know, to notice actually when your mind's going overboard on the problem solving, trying to step back from that, notice that your mind's trying to be helpful, but actually in this present moment, you know, there might not be a solution, and actually overthinking it is just causing you more anxiety and worry. So let's just come and notice that emotion. Let's notice that anxiety. Where am I feeling it? It might be in my chest, it might be in my stomach, and just sit with those physical feelings. Yeah, notice what happens when you sit with it rather than trying to problem solve your way out of it.
Sorry, I interrupted you because we're on to the third point now,
Yeah,
aren't
no,
we?
that was going to lead on nicely actually to the third thing. So the third thing is about the commitment bit, committed action. So this is about really taking time to understand what's important to you, what your values are, how you want to be showing up in this life, how you want to be coming across, how you want to present yourself, what things really matter to you. And then thinking about what might be small steps you can take towards being that kind of person. Okay, so it might be, say for me, you know, when I was going through my treatment, I often just felt like isolating myself from other people. But actually, I've got a really strong value around connection with others, and around being authentic. So although I had this urge to not tell people how bad I was finding the treatment and to just shut myself away and distract myself by watching Netflix, actually that wasn't making me feel better. That wasn't making me feel good in myself. So instead, it might be just reaching out by texting a friend. Say, I'm really struggling today. You know, this is really hard. You know, and if I know that's a friend who will come back and say, you know, I'm here for you. Do you want me to pop round? You know, but it's just taking those kind of small steps towards, you know, the things that are important to you, because of course then that has built my friendships. You know, I am now closer to people than I was before my illness.
And I think the other thing with friends also is that if you are a real friend, you feel like saying, well, if you were struggling, why didn't you come? Friends want to feel valued. Friends
Yes.
want to help. They're very happy to help, isn't it? So it actually works both ways to share that.
Yes, absolutely. And you know, I've had friends read my book who've said, oh, I didn't know that you were having those thoughts and feelings. Now I've read it, it makes sense that you would have those thoughts and feelings. But, you know, even I at times wasn't fully sharing. And yeah, all the time, you know, with my clients, I have conversations around, you know, people feeling like I don't want to be a burden. Other people have got enough going on in their lives. But I think I mentioned this in the book as well, that I was having a chemotherapy session. And a friend had come along with me to the session so she could kind of sit and chat and help me through it. But she was actually going through a really difficult time. then, and she ended up sort of opening up about stuff about her, and she was crying and then going, oh gosh, I'm supposed to be here supporting you, and she felt terrible. But actually I was like, no, I'm more than happy to be here for you. And again, that's another value of mine, why I do what I do for a living, is that I want to be helpful and supportive to others. So actually it felt good for me that I could still play that role even though I was going through something difficult myself.
And I think it also it all, if you help other people, it makes you feel good about yourself.
Yeah.
And that's a really positive feeling to have through your, and I mean a real feeling through your whole
Yeah.
body.
Yeah, absolutely. I suppose the other side of that, and again, something that I reflect on in the book is that I realized when I became ill that I needed to pay much more attention to self-care.
Mm.
Of course, it was something I had been talking about at length with all the clients that I saw, but perhaps wasn't putting that into practice myself. Being a busy working mother, self-care often went by the by. And so, yeah, as much as I love to help others and I wanted to continue to do that throughout my cancer journey, it was also important for me to really invest some time in looking after myself,
Mm.
and to notice the guilt that shows up when doing that, but to just allow that to be there and to carry on prioritizing myself at times anyway. And I guess that's another important point to make, that acting in line with our values often comes with anxiety or guilt, because we're kind of stepping outside of our comfort zone. And yeah, so I may have felt guilty about putting myself first. Or if you think about maybe the things that you're most proud of, that might mean it comes with some anxiety. So having written this book, I do feel incredibly proud of it. When it came to publication date, also came with a lot of anxiety. Will people read it? Will they think it's any good? People are now going to know all this personal stuff about me. So often the sort of the positive emotions that we kind of seek often do come with some downside as well. And so that's another part of this approach, is that you can't have one without the other.
Balance, isn't it? And there's
Yeah,
both sides.
yeah,
Mm.
yeah. Another good example is if you think about falling in love. Love is the most wonderful emotion, and brings with it all kinds of positive feelings. But actually that comes with the risk of being let down or hurt. And we have to, to have that feeling of love, we have to be able to tolerate the feeling of anxiety too.
Absolutely. So you've mentioned briefly about your journey. Would you like to, should we, I mean, there's certain stages that I think were particularly, well, for me, highlighted in the book. So do you want to say a little bit about your journey, and then, and one of the things that I was keen to talk about is understanding values, which you've mentioned as well. But
Yeah,
yeah.
yeah. Yeah, so I had in fact just resigned from my long career in the NHS in 2019, when I got the diagnosis of breast cancer. It came as a complete shock to me. I'd had some other symptoms. I'd had a cyst the previous year, and so I just assumed the symptoms I was noticing at the time were
Mm.
just going to be the same. So it came as a complete shock, as I'm sure it does to most people. And so then I had that agonizing wait to find out about my treatment plan. And my two big fears were having a mastectomy and having chemotherapy. They were the two things that I really didn't want, and I had to have both of those things. So there was a real period of adjustment to that idea, the idea of losing my breast, but also that anxiety about what chemotherapy would be like. But very much I try to use that kind of coming back to the present moment and just trying to focus on, okay, what am I going through right now? What's the stage of treatment that I'm in right now? How can I get through this? And try not to worry about what was to come. So I had a mastectomy and without reconstruction initially because of the treatment that was to follow. And then I had chemotherapy and radiotherapy, and then hormone treatment. And then I later had a breast reconstruction. So yeah, I mean, I found it a really grueling journey, and I had the most amazing treatment through the NHS, through COVID times as well.
Yes, I
I
was just
was
going to say it was COVID as well. You got the whole works, didn't you? That's why I
exactly.
thought, oh gosh, lucky you that you left the NHS just in time. But actually, you went back in again.
Yes, yes. So yeah, I'm very thankful that my treatment was not interrupted by COVID, and I had the most wonderful treatment team. But I suppose what I noticed was that my emotional well-being wasn't inquired about as much as I thought it might be. And sometimes I felt like my treatment team found that difficult to sit with when I was emotional during my appointments. And I remember a nurse once saying, oh, I was going to give you a bit more information today, but you know, you're obviously struggling, so I won't. And I said, no, I need the information. Having information really helps me, and I'm a real planner, so I want to have as much information as possible so I can plan, you know, how I'm going to cope with this. But yeah, she was kind of making that assumption that because I was crying, because I was upset, that maybe couldn't handle anything else. And yeah, so it just struck me really that, you know, if with my training and experience, that if I was struggling with this, then, you know, other people without that knowledge would be potentially finding this even more difficult. And so it was really from the very beginning that I had the kernel of an idea for this book. And yeah, so ACT was a therapy I'd been trained in a few years ago. And actually, I'd found it personally useful before when managing a difficult work situation. But I really found myself drawing on the ACT skills more and more as I went through my cancer treatment, because it is such a good approach when, you know, you can't change your situation. I couldn't change what was going to happen to me. All I could do was try and respond differently to the thoughts and feelings that were coming up for me so that I didn't exacerbate an already difficult situation.
And I think that's really important. And I think also it's very difficult because, you know, the staff in the NHS, as you know, they don't have time. You know, they find it hard enough to have time to give you but let alone the mental support that is required. And I think that's absolutely where your book comes in, is to give people that mental support, and which gives them resilience.
Thank you. Yes, no, that would definitely be my hope.
Mm.
And often you said before about kind of coming back to the values that, you know, it can be very easy to think about, well, I'll do that once I've got through this cancer treatment, or you know, I'll come back to what's important to me then. But it's a long old journey. And actually, when we're not living in line with our values, it has a negative impact on our mood, on our sense of contentment. Now, yes, you know, how we live our lives during cancer treatment is going to have to change significantly, but we can still live in a way that is meaningful for us. So, as I've said before, you know, connection with others is really important for me. So I worked hard to continue to do that. Obviously, COVID made that even more difficult, but we all found our ways, didn't we, of you know, Zoom parties and things.
Exactly.
But so another aspect I talk about in the book is about work. Now, whether or not it's a good idea to work during your cancer treatment, it's going to be very personal to you and what work means to you. But for me, I get a lot of fulfillment from my work. And my identity is quite caught up in being a psychologist. That's really important to me. And so I did choose to continue to work throughout. Now I had to reduce my workload significantly. Whilst I was going through chemotherapy, I would have a week where I felt completely awful and couldn't function. So I could really only work in between my chemotherapy sessions. But I found a way to work, and for me, that did give me a sense of some normality and some sense of still being able to be useful to others. It was a good distraction. And yeah, so and that was still in line with my values, that about being hardworking.
And I think, as I said to you earlier before we started recording, is that, we all think that we have values, or maybe it's just me, but I kind of think, yes, I know what my values are. But if you actually ask me, I'd have to think, oh my goodness, what are they? They're this sort of thing, this shape that I have of what I think they are. But your book is very good because it gives you, it sort of itemizes, and it allows you to think, gosh, that it shapes them for you. And
Yes.
I think that's really important. And I think once you've sorted out what your values are, you can see then how that helps you, guides you through moving forward in difficult times, whether it be from having breast cancer, or, as you said, the other issues you had at work. It's
Yeah.
understanding that you keep true to what you believe is right for you.
Yes. Yes, absolutely. And we can get a bit confused, I think, sometimes between values and goals. So often we might think about values as being things like, I want to get a good job, and I want to, you know, have a nice house or something like that.
Mm.
But this is values in this context is more about, yeah, what qualities we want to demonstrate, and what yeah, in what way do we want to live that is showing those qualities.
Yeah, how do
Yeah.
you behave? And I
Yes.
think sometimes it's very easy when you're very ill to not be selfish because you're in pain or whatever
Hmm.
it is. But if you look back, you think, gosh, I can't believe that was me. But if you have the value of, you've got it, that this is how I want to look to be to people, if
Yeah.
you know that's your value, then you think, gosh, the way I am behaving is not true to that value.
Mm.
And it sort of keeps you in
Yeah.
the right lane.
Yes. Yes. Absolutely. Yeah, we often talk about it being like a compass point.
Mm,
So rather than a destination, it's a compass point that's helping you in the direction of travel.
absolutely. The other thing in your book, which I thought was interesting, was about telling people, because I think it's very important that if you want to tell people, should you tell people, and how
Mhm.
do you tell people?
Mm. Yeah, again, it's a very personal one, as to how widely you want to share about your diagnosis. For me, I tend to be quite an open person. I've got these strong values around being authentic and connection with others. So for me, it was important to tell other people. But I guess there's still, I would still have my closer inner circle with whom I'd
Mm,
be more honest and open about what was going on. Um, had I not needed chemotherapy, where it's very obvious because of the loss of hair, etc., I may not have spoken about it so widely, perhaps. Um, but yeah, it's a very personal choice, I think, who
mm,
you want to tell and how much you want to tell. Um, and but it's also I think it was a real journey for me in learning actually who really was there for me, and who maybe I couldn't rely on as much as I thought. It's always interesting, that process, isn't it?
But if you've got your values as well sorted out, then you then realize, well, actually, the people that you thought were going to step up didn't. But if you know your values, then it minimizes, I imagine, the fallout of feeling that rejection or let down by those
Yeah,
people.
yeah, yeah. And it wasn't that I didn't feel let down, but what I felt was, well, okay, I don't need to invest so much in that relationship.
Mm,
So actually that freed me up, yeah, to be less concerned. It's like, oh, okay, they're not that kind of friend, they're more this kind of friend who, maybe I can go out with and, enjoy the occasional night out with, but I'm not necessarily
yeah.
going to share
And
my.
which is fine as well.
Exactly. Yeah. We all need different types of
Yeah.
people in our lives. But yeah, it enabled me to kind of just let go. I'm kind of person, I tend to put quite a lot of pressure on myself to maintain relationships. So it enabled me to go, okay, I don't need to put so much emphasis on that relationship. I can let that go a bit. So yeah, so that was helpful. Um, I also talk a little bit about telling my children, which was, incredibly difficult. And obviously what you tell your children is going to depend very much on their age.
Mm,
Um, but yeah, because I tend to be quite an emotional person, and my husband too, we kind of didn't really feel that we could act normally around the children. And what we know about children is they're good at picking up when things aren't right, and if they don't know the real reason, then they'll make up all kinds of explanations in their mind. So yeah, so we have been open with them in an age appropriate way throughout.
but I think that's right with children, is that they're far, using that word again, children are far more resilient. They're far more grown up, or they're far more mature in many ways than one thinks emotionally. As long as you're doing everything age appropriately, they
Yeah.
can understand it. It's when it's, smoke and mirrors. They know smoke and they are the first ones to understand, and
Mm.
far more perceptive often than an adult in understanding there's something not right.
Yeah, and it's really important to keep the lines of communication open, so they can always feel like they can come back and ask questions,
Mm.
and say if they don't understand, or say if they're worried about it, or yeah, and that's it's difficult, and it's been a really difficult part of the journey.
Yes, it is difficult because you're keeping in check your own emotions
Mm,
whilst explaining. But I suppose because it does go, it's not as if it's a piece of news that then disappears after a week. It goes over a period of time, and in that time, you're changing. Your understanding and feeling of it changes as much as a child who, if it's for 2 years, that child is developed. 2 years is a
mm,
lot in
yeah,
in development for a child.
yeah, absolutely.
So then I think sort of moving on, through your journey, the other bit which I thought was very interesting, and we don't necessarily talk about, we talk about, you mentioned about mastectomy was the thing that you dreaded, and guess what? You had a mastectomy. It's always sod's law, isn't it?
Yeah.
That those things, and you read a lot about, gosh, and this is what you can have, and da 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 da. But there's not always that thing about what your own body image and perception is, and your value of how you feel as a woman with these things.
Mm, mm. Yeah, I mean, I don't think I had any way really of navigating that. I sort of found my own way through it. And again, it was my psychological knowledge that helped me with that. So when I was first given the information about it, there was a sort of information booklet, and it had line drawings of a woman with having had a mastectomy. And I literally couldn't even look at those
Mm.
line drawings without feeling physically sick and repulsed, really. And so I did my own little sort of exposure exercise, which was just to sit with those really uncomfortable feelings, but keep looking at this picture, because I was thinking, you know, there's no way, I've got to go through
Mm,
this, so I've got
mm,
to get comfortable with this one way or another. And then once I felt comfortable sort of looking at the line drawings, and I went on to look at some proper images of women post mastectomy. And actually when it came to it, I think, yeah, it wasn't so bad, probably because I'd done that. It wasn't so bad when I looked at my own body post-surgery. But it was something that I continued to struggle with. And yeah, I did have some sort of peer support through a charity. They match you with someone who's gone through a similar experience, and so I asked to be matched to someone who'd had a mastectomy and hadn't had a reconstruction, and that was really useful talking to her. But you know, over time I decided that I wasn't happy. It was the kind of asymmetry that I felt unhappy with, and the kind of faffing around with having a prosthesis in my bra and that kind of thing. And so I decided to go ahead with having the reconstruction. And that's been great. I'm absolutely really pleased that I had it, but it's not perfect, and I have to live with that as well. I do tend to be a bit perfectionistic about the way I look. Yeah, it's hard to know that they're still uneven, even though they were uneven before.
I
Let's
was
say.
going to say, are they ever even?
Exactly, yeah. So I wants to come out with a perfect pair at the end of it, but
No, but it's another big, you're then going on for another sort of surgery, isn't it? It's not all just one surgery in one go.
no,
You're going through, and as with all surgery, you have to weigh up the pros and cons.
yeah,
Surgery has its own risks.
yeah, absolutely. And I, I had people in my life saying, oh, what are you doing that for? You know, it's only you and your husband that see you naked these days, you know.
Oh,
So other people have their views.
well, they don't know what you do in your personal life. You might be showing everybody.
But yeah, it's you feeling comfortable in your own skin at the end of the day, isn't it? And you
Mm,
know, that was what I wanted, was to feel comfortable enough to look at
yeah.
myself in the mirror, and yeah, to feel okay.
Well, Sarah, thank you so much for sharing. As I said, it was a really personal journey, but with no soap suds, no sad sobbing going on in the background. Because when you say personal story, you think, oh my goodness. But it's not. It's just you're saying, this is how I felt. This was difficult, and how I managed it. And as I said, it felt like someone was holding my hand saying, it's okay. Yes, it's crap, but we're going to get there. We're going to get through this, and it will be all right. And I think, and I suppose the other thing to point out, you wrote this specifically for people with this was primary cancer.
Hmm.
Although you do mention about people who very sadly who do have terminal
Hmm.
conditions, you do mention that, but this is very much from the raw thing from the very beginning for you.
Yeah, yeah, and it's not that this approach can't help with other types of cancer, or
Yeah.
you know, if you have secondary cancer, or but it's it's my personal experience of having primary breast cancer. Yeah.
Well, I'm sure that it will help people,
Thank
especially
you.
listening to this.
Thank you. That means a lot.
Thank you very much, Sarah. Thank you, Dr. Swan.
Thank you.